Hello everyone, I'm Ernie Bjorkman. Welcome to the American Health Front. The purpose of our program is to educate and inform you, the viewer, about treatment options now available in the ever-changing world of medicine. This is a special Bay Area edition of American Health Front. Our staff has teamed up with some of the area's finest physicians and healthcare facilities to explore the fascinating frontiers of today's healthcare, with reports on new techniques and technologies that could really change your life. So stay with us, because there's nothing more important than your health. We all know that a healthy smile is important to our overall health, but when our gums start to get in trouble, there may be an alternative, less invasive option to make your treatment less painful. It comes from an innovative application of laser technology. It's called laser-assisted periodontal therapy. We'll explain how this works and what it can do for you. But first, we're going to take you to Dr. Amini of CitiDent. Dr. Amini has UCSF credentials and holds numerous national and local memberships in the field of dentistry, and has a fellowship status in the World Clinical Laser Institute, and is one of San Francisco's most premier cosmetic dentists. His patients experience exceptional care with personal attention, along with the latest technologies in dentistry.
Periodontitis is very common and is widely regarded as the second most common disease worldwide after dental decay. If left untreated, it causes progressive, irreversible bone loss around teeth, looseness of the teeth, and eventual tooth loss. The disease is affecting approximately 50% of U.S. adults over the age of 30. Research now supports correlations between gum disease and the heart, kidney, and liver disease. So it's very critical to catch the disease in the early stage and offer minimally invasive treatments to patients to stop the gum disease from getting worse. As pockets form around teeth in excess of 4 millimeters, the disease changes form. And when pocket depths reach 5, 6, 9 millimeters and beyond, there is no way anyone but a dentist or hygienist can get to the bottom of the pockets and clean them. As a result, you have debris and bacteria living in these pockets that can lead to chronic gum infection, bad taste and odors in their mouth, and ultimately to bone loss and tooth loss.
So does this mean taking out the scalpel? Maybe not just yet.
Up until very recently, the main way to control moderate cases of periodontal disease involving deep pockets was to literally cut away the gums so pockets can be kept small and clean by patients. It can be a radical and painful procedure, and because of that, some patients fail to follow through and finish the surgery for the entire mouth. Periodontal surgery is something that can always be done after less invasive procedures are offered. And in many cases, laser-assisted periodontal therapy is the perfect alternative. Basically, when we see a patient that has early to moderate phase of periodontitis, we offer them scaling and root planing combined with 2 to 3 episodes of laser treatment and localized dose of antibiotics in the pockets. The laser disinfects the pockets and destroys the bacteria without harming the natural tissue. After 6 weeks, we reevaluate the area, and often we find dramatic improvement in a lot of patients. It requires no to minimal amount of anesthetics, no surgery, and a lot more comfortable gum treatment.
I had a history of bad gums and had surgery before, which was a very, very uncomfortable experience. Came in to see Dr. Amini, who recommended that I do laser surgery, and I had that procedure done in the afternoon, no pain whatsoever, cleaning of some deep pockets, and I went home that night, didn't even mention it to my wife. Had a lovely dinner. It was that unobtrusive an experience.
Dr. Amini works closely with the staff periodontist at CitiDent if more conventional surgical treatment is deemed necessary.
Periodontal surgery may still be necessary in the advanced cases of gum disease or if other methods of treatment don't respond. The most critical factor is timely visits to your dentist. That's what counts. They can keep an eye on your teeth and your gums to make sure they stay healthy and last a lifetime.
Now introducing another breakthrough laser technology in minimally invasive dentistry that is taking the guesswork out of cavities. Locating hidden decay before it destroys tooth structure from the inside out is a major goal of minimally invasive dentistry.
When we're trying to look for cavities in the pit and grooves of the teeth, we traditionally use an instrument called an explorer. The hidden decay, which are generally shaped like a teardrop, tend to escape the detection with the explorer because they don't catch the instrument's tip. And also there are some pit and groove catches that are not necessarily cavities. That's why there are many opinions involved. One dentist's stick is another dentist's decay or a watch. Now we have a way to quantify this. This is one of the reasons a patient goes to 2 different dentists and gets 2 different diagnoses and treatment recommendations. With DiagnoDent, we're able to confirm and quantify the lesions. A pen-like probe simply slides over the tooth surface, constantly checking the suspect areas. A number scale and alarm signals the operator when there are indications of decay. This new FDA-approved technology is completely safe and pain-free. When the cavity is detected and quantified, and it's in the early stage, we then use a double dose of technology with Waterlase MD, removing those small lesions with little to no use of shots or anesthetics or the drill. Waterlase is an FDA-approved instrument for cutting both hard and soft tissue of the oral cavity. It uses laser energy and water. It's a process called hydrophotonics to remove cavities and work around the gums. Again, we seldom need to use shots for this procedure. Laser technology is here to help dentistry by offering alternative ways to diagnose and treat the problems in the mouth by using a cutting-edge technology. It enhances the patient's experience in the chair and prevents problems before they get worse. Early detection and early treatment means quicker appointments with more comfort and less cost to patients, and ultimately improving the healthcare systems in the world.
Dr. Amini and the staff at CitiDent take pride in offering a new experience in dentistry with state-of-the-art technology, compassionate and gentle care, all in a relaxing, comfortable atmosphere that makes you want to come back.